All right, so let us move on to the part 2, which is the introduction to Morita Therapy. Meet Dr. Shoma Morita and his Morita Therapy. He did not call this therapy Morita Therapy himself. It is the name given by his successors. So what did he call this treatment of his? Is my special treatment for Shinkei-shitsu. It has over a 100-year history. It is founded around 1919. So we just celebrated the 100 years of Morita Therapy, embarking on a new century. It is originally developed for the treatment of Shinkei-shitsu, which I will talk about in the next slide or so. And it is notable that Morita was Shinkei-shitsu himself. So please know that this is based on his own experience of overcoming his fear of death. I love this photo because many of the psychotherapist founders have a very stern look, but this photo really articulates his warm, kind, and humane personality. Oh, here's the famous quote of Morita himself in his seminal work, Shinkei-shitsu no Hontai to Ryōhō. So he begins his entire collection of book explaining his treatment with this quote, saying, treating illness is so that the person can live life fully. Without the life, the illness has no meaning. I would love to ask, what did you take out of this quote? And here's what I have taken from this quote. And I know this is tiny, but it says DSM-5 TR. So what I took out of this quote is that his scope was beyond pathology. Is that we oftentimes focus on disorders, but he's telling us, wait, there's a life, a bigger life beyond this disorder. How can we treat disorders if we don't appreciate the wholeness of patient in his or her or their life? And this is the tone initially set by Morita. 4 reasons, but I really love this quote, setting the scope of Morita Therapy, being life. This is a rare find from a book by Abe, edited by Ohara Sensei. Is the Dr. Shoma Morita and his special treatment for Shinkei-shitsu is a distinct milieu of treatment. This is actually his house. He ended up opening his own house to start his special treatment for Shinkei-shitsu. And there's a specific reason that I could guess why he opened his this ecological milieu. But just to know that he used his own house as the treatment facility. And I was told that he, his wife had a significant role to play because he's looking after the patients, and his wife looked after their day-to-day needs, like a meal. So it was a really at-home family environment, and the milieu and the climate that they thrive to create to treat this Shinkei-shitsu. Just to add to it, Shinkei-shitsu is a particular kind of trait, and it is different treating a state versus trait, because the latter touches on our personality, which is more persistent, as compared to the state, like anxiety. Oh, you're familiar with state versus trait anxiety. So in order for someone to look into their personality, which was formed over how many years did it take for you to form your personality? So he had to open more 24/7 holistic milieu and environment in which that he could operate on his client. He could relate to his client in a more holistic and day-to-day manner. So that called for his opening up of his own house. So here is the list of the authentic 18 principles of Morita Therapy. I'm aware that this is not translated into English, but I wanted to introduce to you, there are 18 of them. And they are included in this background photo of the standard edition of the collected works of Shoma Morita. And especially in the volume 1 and 2 includes articulation of the 18 principles of Morita Therapy. So these are the principles that he himself described, which is rather on a technical and more abstract principle level. So today I am not going to cover this authentic 18 principles, but rather more digested version of his principles, which I outlined in here. So I organized them according to the principles that helps us understand Morita's view of human nature, principles that helps us understand Morita's view of unwellness, and view of wellness and view of change. So that is the principles and fundamentals that I wish to introduce and share with you today.